Our hospitals are spiralling into debt, faced with the challenge of treating more people without more money. Now, England's regulators have told trusts their spending plans for the rest of this year are simply unaffordable to the NHS. A clear signal, say the experts, of how critical the next few months will be.
We may see hospitals and some other providers starting to simply run out of cash and having to make very short-term big cuts to rebalance the books. And it's very difficult to protect patient services when you do that.
So hospitals have been told to rein in their budgets by only filling staff vacancies considered essential and by squeezing the greatest possible efficiency out of staff roster patterns.
NHS management teams have always had to strike this balance between, on the one hand, staying within the budget and on the other hand, providing an absolutely fantastic quality of care. This year, it's a particularly difficult issue because we've had 6 years of 1% funding increases when over each of those 6 years, demand has risen by 4%.
Another pressure has been the fact that hospitals pay fines for failing to meet national targets. That penalty regime is now being relaxed, with one fine for failing the 18-week waiting target scrapped altogether. We can reveal the scale of the saving that may create for hospitals. A 5 News investigation found trusts were fined almost £26 million last year for missing the waiting time target, and the total burden of penalties on hospitals was almost £500 million. The boss of this trust, which expects to end this year well in the black, says hospitals could find savings, but red tape is holding them back.
We can do better. We can try a little harder. We can cooperate more in the National Health Service and on occasions to do things just that little differently. On the other hand, we also need to look at the overarching bureaucracy of the National Health Service and rationalise it, and I'd like to see that happen very quickly.
The NHS is in a deep financial hole, with 4 out of 5 hospital trusts predicting they'll end this financial year in the red. Now the regulators have delivered their verdict. Everything that's been done so far to prevent that is not enough. Catherine Jones, 5 News.